racial inequities. And so we've been calling this a twin pandemic. This is a twindemic, one that we knew that has been here for decades, for centuries, that we've been battling day in and day out. And now this virus that we've been also dealing with right here at home and abroad. And so as we talk about our communities, we also have to recognize how we made contributions. We made contributions in science. We've made contributions in communication. And we've also made our contributions in ensuring that services were available. Over 75% of our frontline workers, essential workers, are people who are coming from other countries, were not born in this country. And we were responsible, as a health department, we were responsible for keeping those folks safe. And part of our message was making sure that we had sound science and evidence of what we need to do, face covering, washing of our hands, making sure that individuals had access to testing, but also making sure that we knew that there have been challenges around other issues, around healthcare access, availability of food, prescription medication, transportation, all the things that we know are also supportive of making sure that someone is healthy. And so that was important for us, that we weren't just talking about this virus, but we were also talking about how do we ensure that individuals are getting the right care. That was important for us because we know that there are high rates of diabetes, high rates of hypertension, other chronic illnesses that also lead to higher risk of COVID-19. And so we had our hands full. And so I want to thank all of you for the work that you did in just making sure that you followed our guidance, ensuring that people stayed home if they're sick, wearing your face coverings, washing your hands, making sure that you kept 6 feet. This was all, as we were learning, we were pushing out this information, but also making sure that people were following these guidelines as they were returning to work. We're now in phase 4. We do not get to phase 4 without all of your contributions, without your commitment to making sure that we keep New York safe. But we're also pushing back on the narrative that, one, that people of color are more susceptible to this disease. I mean, we heard the messages that we heard, and we just couldn't understand where they were coming from. The narratives, baked and soaked in racism and discrimination and bias and oppression. And so we made sure to get out information about how we could really combat and address structural racism. Anti-stigma information, not only for the African immigrant community, but also for our Asian American communities as well, because we heard the stigma loud and clear, and we needed to make sure that we were very clear about how we were pushing back. And so our government, our agency, made sure that we were working to put forward an equity action plan. Part of our equity action plan was making sure that we also communicated, but we also worked across communities with organizations. And so I'm happy to be working with African communities together, and David and so many other organizations, to make sure that we are getting out the message. You've already heard David talk about the availability of testing, but we're also making sure that individuals have ways in which they're getting connected to the tracers. So those tracers are the folks who are calling you, who are asking about your contacts, or asking about your exposure, and making sure that they're supporting you and getting the resources that you need to how to isolate and quarantine. One of the things that we wanted to make sure that we do is not come heavy-handed in doing enforcement. And so we worked with a number of community-based organizations to ensure that we did not mandate enforcing isolation and quarantine. I mean, we're just coming out of all of the conversations around family separation. You remember, during this administration, folks in the White House have been talking about separating families, moving them into detention centers. And so if we were to come heavy-handed and say we need to enforce individuals to isolate and quarantine because of this disease, it would have caused an uproar. And so that's why we've been working with organizations to really make sure that we are messaging this process correctly. We needed to know how it was going to land. And so we built out a community advisory board. We've been working and listening about the messaging. Many of the posters, many of the tweets that you see that are coming out This has been informed by community organizations that we've been working with. How we come into the community really is going to be important about how we are being responsive to the partners that we're working with. And so I ask that you continue to work with us hand in hand so that we can move this forward. We're trying to keep people safe because we know that we're not out of the thick of it. We do not have a vaccine that is safe enough to distribute yet. And so part of the process is we need to make sure that we have access to the testing and all the resources that are necessary. And so what you'll see over the next couple of weeks and next couple of months, what we're dealing with now is we're starting to see increases in cases. You might not want to hear it, but yes, we're seeing increases in cases again, like we saw in early March. We're seeing the cases increase in parts of South Brooklyn, parts of Queens. And so the focus now is really making sure that we bring all our resources to bear to those communities so we do not get the spread in other communities. We have 59 community districts. In this city, there are hundreds of languages that are spoken. There are different ethnicities that are represented in our communities. And there are many ethnicities that are represented here today. And so we want to be responsive. We want to make sure that we're getting the information out.
Coronavirus barawa